2023 CNA Practice Questions with Rationales. Question number 1. A patient is sobbing. What is the best thing for the nursing assistant to say? A. Stop crying. B. Please, try to cheer up. C. You do this every day. D. You appear sad. The correct answer is D. You appear sad. Communicate with kindness and encourage the patient to voice their concerns. Monitor for signs of depression with elderly, which include the loss of appetite and sadness. Question number 2. A patient has had hip surgery. Her legs should be A. Abducted. B. Adducted. C. In the most comfortable position for the patient. D. Elevated. The correct answer is A. Abducted. Most patients use an abduction pillow after hip surgery. Question number 3. A patient rings for the bedpan while visitors are in the room. The nurse assistant should A. Wait until the visitors leave. B. Give the bedpan to the patient in front of family. C. Ask the visitors to leave the room during the procedure. D. Ask the supervisor what to do. The correct answer is C. Ask the visitors to leave the room during the procedure. This allows the patient time for privacy while using the bedpan. Question number 4. A patient complains of pain. A nurse aide who has completed the basic certified nursing assistant course should A. Get the patient some pain medication. B. Call the doctor. C. Tell the medication nurse. D. Tell the patient to tell the medication nurse when he or she comes in. The correct answer is C. Tell the medication nurse. As a nurse aide, you cannot give medications. However, you may be able to use non-pharmacological therapies, such as massage, repositioning, and range of motion exercises. Question number 5. Which of the following should be reported immediately? A. A blood pressure of 90/40. B. A pulse of 90. C. Respirations of 12. D. Temperature of 99.4. The correct answer is A. A blood pressure of 90/40 is considered to be a low blood pressure reading. Question number 6. A patient known to have Alzheimer's disease tells the nurse assistant that she smells smoke. The nurse aide should A. Reassure the patient that there is no fire. B. Tell her that no one is allowed to smoke in the building. C. Look around for a fire. D. Put the patient to bed because she is clearly tired. The correct answer is C. Look around for a fire. Patients with memory loss can have moments of clarity. Question number 7. An aide is pushing a resident down the hall with a wheelchair when a call light lights up. The aide should A. Continue pushing the patient and assume someone else will answer the call. B. Take the patient inside the room while answering the call. C. Put the patient back to bed and then answer the call. D. Push the patient to a safe place, apply the wheel locks, and answer the call. The correct answer is D. Push the patient to a safe place, apply the wheel locks, and answer the call. Patient safety is your priority. Question number 8. Trays have arrived. Before serving each tray, the nurse aide should A. Check each armband, even on familiar patients. B. Ask about dietary restrictions. C. Check the temperature of the food. D. Ask patients if they are hungry. The correct answer is A. Check each armband, even on familiar patients, to ensure that the patient has received the correct tray. Question number 9. Nurse aides should always wear A. Clean uniforms. B. Comfortable nursing shoes. C. Socks without obvious holes. D. All of the above. The correct answer is D. All of the above. Question number 10. A resident complains that his children never visit. The aide should A. Tell him that they will come soon. B. Tell him not to worry, it will be all right. C. Listen with empathy. D. Tell him that he should have been nicer on the last visit. The correct answer is C. Listen with empathy. Active listening is a technique used by healthcare providers to reflect on what a patient has said and can help patients feel better understood. Question number 11. A patient appears more pale than usual. The nurse's aide should A. Note it on the chart. B. Ask the patient how she feels and take her vital signs immediately. C. Get the patient a snack. D. Offer a glass of water. The correct answer is B. Ask the patient how she feels and take her vital signs immediately. Changes in skin color could indicate that there has been a change in her vital signs. Question number 12. After the end of the shift, some nurse aides go to a restaurant. Acceptable topics of conversation would include A. Their patients. B. Procedures that others in the restaurant might not want to hear about. C. Hospital politics. D. The weather. The correct answer is D. The weather. Keep patient and work-related information confidential. Question number 13. A patient who was given insulin in the morning is pale and sweaty and appears confused 2 hours later. It would be helpful to find out whether the patient A. has diabetes, B. had breakfast, C. had visitors that day, D. ate too much sugar. The correct answer is B. Ask if the resident had breakfast. His blood glucose level could be low. Question number 14. A resident's daughter expresses concern because her father, who has Parkinson's disease, appears stuck at times and stands still, unable to walk. The nurse's assistant should tell the daughter that A. that is a common sign of Parkinson's disease. B. her father has likely had a stroke. C. he is confused. D. he just doesn't feel like walking. The correct answer is A. A freezing gait is a common sign of Parkinson's disease. Question number 15. A resident is standing in the hallway holding a bag and asks the nurse aide when the train is due. The aide should tell her A. that she is being ridiculous, B. where she is, in a calm tone of voice, C. to go back to her room, D. that it should be here any time now. The correct answer is B. Tell the resident where she is, in a calm tone of voice. Orient and reorient patients by explaining where they are, who they are, and your role in their health care. Question number 16. On what side should the patient lie for an enema? A. right, B. left, C. whichever side is more comfortable, D. the side closer to the restroom. The correct answer is B. The reason for laying on the left side is for gravity to assist the fluid filling the colon. When the patient lays on the left side, the fluid can go up further into the colon. Question number 17. What is the best way of keeping a skilled nursing facility from having an unpleasant odor? A. Keep all the windows open. B. Use an air freshener regularly. C. Empty bedpans and change linens in a timely manner. D. There is nothing you can do. The correct answer is C. Empty bedpans and change linens in a timely manner. Question number 18. A nursing assistant notices red marks on a resident's buttocks and heels. The aide acts in the knowledge that A. red marks are not a problem, B. the skin can break down if nothing is done, C. patients can only be turned every 2 hours, D. it takes a doctor's order to rub skin with lotion. The correct answer is B. The skin can break down if nothing is done. Reposition the patient and notify the nurse of the reddened areas. Question number 19. A patient complains that her hand hurts where the IV is running. The nursing assistant notices that the hand is puffy. The best thing to do is A. Notify the medication nurse that the patient is complaining of pain. B. Reassure the patient that needles always hurt. C. Put ice onto the hand. D. Notify the nurse that the infusion appears to have infiltrated. The correct answer is D. Notify the nurse that the infusion appears to have infiltrated. An infiltrated IV, intravenous, catheter happens when the catheter goes through or comes out of your vein. The IV fluid then leaks into the surrounding tissue. This may cause pain, swelling, and skin that is cool to the touch. Some IV medicines can cause your skin and tissue to die, necrosis, if they leak into your tissues. Question number 20. A nurse aide walks into a room and sees that the patient is not breathing. The first thing the aide does is A. Press the alarm to call the CPR team. B. Shake the patient's shoulder while shouting his name. C. Hit the patient's chest. D. Tilt the patient's head back and give 2 quick breaths. The correct answer is A. Press the alarm to call the CPR team. You can begin hands-only CPR while waiting for the CPR team to arrive with the crash cart and resuscitation equipment, if the patient does not have a do not resuscitate order. Question number 21. A patient complains of feeling short of breath and nauseated. Her face is rapidly turning red. She tells the nurse aide that she didn't know there were strawberries in the gelatin she ate. The aide should A. Notify the nurse immediately. B. Tell the patient that fruit is good for you. C. Take away the tray. D. Note on the chart that the patient appears to be allergic to strawberries. The correct answer is A. Notify the nurse immediately. A serious life-threatening allergic reaction, known as anaphylaxis, can occur within few seconds or minutes of exposure to allergic substances. This involves hives, swelling and sudden drop in the blood pressure and sometimes shock. Question number 22. The brain is part of the A. Locomotor system, B. Endocrine system, C. Nervous system, D. Exocrine system. The correct answer is C. The nervous system has 2 main parts, The central nervous system is made up of the brain and spinal cord. The peripheral nervous system is made up of nerves that branch off from the spinal cord and extend to all parts of the body. Question number 23, which of the following causes the most infections in healthcare facilities? A. Airborne bacteria. B. Unwashed hands. C. Contaminated food. D. Sick visitors. The correct answer is B. Unwashed hands. Washing hands prevents illnesses and spread of infections to others. Hand washing with soap removes germs from hands. Question number 24, there is an order to give the patient a shower, but she refuses. The nurse assistant should A. Take the patient to the shower anyway. B. Tell her that she must do what is ordered. C. Document in the chart that the patient refused to shower. D. Threaten to use restraints if she does not cooperate. The correct answer is C. Document in the chart that the patient refused to shower. Ask the patient the reason for refusing. Also, notify the nurse. Although patients have the right to refuse care, daily bathing can help keep the patient's skin healthy, control odor, increase comfort, and allows the nurse aide a chance to assess for skin breakdown. Question number 25, a patient suddenly complains of feeling weak on one side while he is getting a bed bath. The nurse's assistant should A. Tell him that weakness is normal at his age. B. Prop him up with pillows. C. Report this to a nurse immediately. D. Pass it on at end of shift. The correct answer is C. Report this to a nurse immediately. Facial drooping, slurred speech, and sudden weakness on one side of the body are signs of a stroke. If you found this video helpful, please like it and subscribe to our channel. Thank you for watching.